Chemotherapy has side effects. Will it make cancer worse? People always say that chemotherapy is painful, not only causing nausea and vomiting, but also causing hair loss, and even speeding up death. Is chemotherapy really that scary? Not only is it ineffective, but accelerates the deterioration. Chemotherapy, surgery, and radiotherapy are three important treatments for cancer. Chemotherapeutics, also known as cytotoxic drugs, have a strong toxic effect on fast-growing cells in the body, so they will kill the crazy-growing cancer cells. However, chemotherapeutic drugs do not have the ability to distinguish cells. While attacking cancer cells, normal cells will also be damaged. Therefore, chemotherapy patients often have side effects such as nausea, vomiting, bone marrow suppression, and hair loss. Question 1. Do all chemotherapy patients have serious side effects? The answer is no. Every body is different, and the side effects of chemotherapy will vary greatly. In the hospital, you can see many chemotherapy patients who don't lose their hair, and they are also full of energy during chemotherapy. Even if there have side effects, as long as the drug is stopped for a period of time, along with timely and effective treatment, the adverse reaction caused by chemotherapy can recover. At the same time, periodic chemotherapy and active prevention and treatment of adverse reactions have reduced the occurrence of side effects while controlling cancer. In addition, with the development of medicine, the side effects of chemotherapeutic drugs are getting less. Therefore, there is no need to be very afraid of chemotherapy. Question 2. Is chemotherapy not only ineffective, but also harmful to the disease? This is wrong. Although chemotherapy has obvious side effects, it plays an important role in fighting cancer. Comprehensive treatment based on surgery is the current principle of cancer treatment. However, cancer is a systemic disease. Many patients have advanced cancer at the time of diagnosis. Surgery cannot remove all cancers in the body. Chemotherapy is a systemic treatment that enters the body through oral or intravenous injection and can reach all parts of the body with blood circulation. Chemotherapy is an important adjuvant treatment method for cancer. Different types of cancers have different sensitivity to chemotherapy. Some cancers are highly sensitive to chemotherapy, and a higher cure rate can be achieved by chemotherapy alone. There are also some cancer types that have significantly increased survival rates through chemotherapy. Therefore, chemotherapy is indispensable. Question 3. Cancer patients do not need chemotherapy after surgery? After surgery for cancer, it is necessary to evaluate whether chemotherapy is needed based on the type of cancer and physical condition of the patient. For patients with early cancer, the cancer can be completely removed by surgery. However, residual cancer cells or undiscovered micrometastases during surgery can cause cancer recurrence and metastasis after surgery. Therefore, in order to eliminate the micrometastasis and kill a small part of the remaining cancer cells, the doctor will recommend timely postoperative adjuvant chemotherapy to kill the cancer cells that may still be in the body. The object is to reduce the recurrence rate of cancer after surgery. In addition, some patients have large cancers when they are first discovered and cannot be completely removed by surgery. At this time, neoadjuvant chemotherapy before surgery will be applied to reduce the cancers, hoping to transform them into resectable cancers. Although chemotherapy is a systemic treatment, local chemotherapy can also control symptoms. For example, some cancer patients have pleural effusion, chest pain, chest tightness, and even breathing difficulties. At this time, chemotherapy drugs are injected into the chest cavity to reduce the production of pleural effusion, thereby improving the patient's quality of life. Therefore, chemotherapy is not a killer, but a treatment method that has been proven to be effective through medical practices. But chemotherapy must be in accordance with the indications. Before chemotherapy, the doctor will evaluate whether the patient is suitable for chemotherapy based on the patient's cancer type and physical condition. Question 4. Immunotherapy and target therapy are popular. Will chemotherapy be replaced? The answer is no. In recent years, significant progress has been made in the field of cancer therapy, including immunotherapy and target therapy. However, the effective rate of using immunotherapy or target therapy drugs alone is only 20%. Immunotherapy or target therapy needs to be combined with chemotherapy to fight cancer together. Therefore, chemotherapy is still a powerful treatment against cancers. In conclusion, chemotherapy plays an important role in cancer treatment. The currently commonly used chemotherapy regimens are all proven feasible. Clinicians will comprehensively consider whether the patient can undergo chemotherapy, which chemotherapy regimen is feasible, and when to terminate chemotherapy based on the patient's cancer type and physical condition. Medical scientists are also making continuous efforts to develop highly effective and low-toxic chemotherapeutics to provide better treatments for cancer patients. If you like this video, please subscribe our channel for more.